Welcome. My name is Kim and I'm a nurse, and I'm glad you're here today for our CPR webinar. We're going to be talking about bleeding and burns and also doing a review of child and infant CPR. So welcome. Let's start with our presentation. All right, here we go. So this webinar is sponsored by the DISC Foundation. And like I said, my name is Kim. I live in Maryland, right outside Washington, D.C., and I'm the medical educator. I've recorded this video ahead of time instead of giving it to you live. I am working over Memorial Day weekend and the week before, running a medical team for a CrossFit semifinal. So I'm very busy this week. You're going to see DISC Foundation and also Save a Life as the sponsors throughout this presentation. The DISC Foundation was created for the sole purpose of empowering others to save lives. So I provide free healthcare education to anyone who asks. And it's really great that we're being sponsored for this initiative. So why do we learn CPR? Of course, we want to help people save lives. Some of the statistics that we're basing this goal on are that in 1 year, we had 300,000 people in the United States who had a cardiac arrest out of the hospital. The survival rate to discharge was only 10%. So that's not very good. In hospital, the cardiac arrest rate was around 20%. So we want to increase that. Along with the American Heart Association, our goal is to increase that to closer to 40%. People do have fears about performing CPR. If you've never done it before, of course, that can be scary. You might have a scene that's unsafe, something inside where there's danger, something collapsed or a bookshelf fell over. In that case, you need to call the firefighters, fire department to come assist you. If you're worried about disease, that's very valid. And right now with COVID-19, all of our first responders are wearing a lot of PPE or personal protective equipment. So you want to make sure you do have gloves available in your first aid kit. Also a CPR mask, very inexpensive to buy. You can get plastic barriers or a regular mask from the Red Cross or anywhere on the internet. And that will help you with not transmitting any diseases. Also, people might be worried about liability, and we are protected there in. So the Good Samaritan law in the United States and several other countries protects anyone who stops to help at an accident. You might be giving first aid, or you might have to do CPR, or maybe you're following along with a 911 operator and doing what they are recommending. Doesn't matter if you know what the outcome is, if you are having a good intention and following your level of skill, then you would be covered in any kind of lawsuit, which means you would not be held liable for money or any criminal act or anything like that. So we don't have to worry about that. Even if the person dies from cardiac arrest and you were attempting to help, you would be covered. So that's very reassuring. Some people are worried about hurting a patient, and we do have to remember that in cardiac arrest, the heart is not beating. If we do nothing, stand there and watch, they will die. They're not going to just come back to life on their own. So, yes, sometimes patients might have bruising or even break a rib from CPR, but that's expected. It's okay. We just move on and continue, and hopefully, CPR will help someone um, get their heart started again. If you're not sure of your skills, then it's great that you're here and you're refreshing how to do CPR and learning some first aid. We have lots of videos on our website and material that you can read that I will show you. And it's just really good to practice and um, use that education that's being offered to you. So we have a chain of survival, and this is the order that things will happen if there's an emergency. For pediatrics, you can see that first step is the most important thing, which is prevent arrest. So that includes childproofing, watching children at all times. The number one cause of death for children is accident or injury. So in theory, we can prevent that. Now, if something does happen, we want you to recognize right away that there's an emergency or a problem and call 911. If the child needs CPR, they're not breathing, we want you to be able to perform CPR right away within 10 seconds. These next steps are for the healthcare providers, the ambulance, the paramedic, the ER physicians and nurses, and everyone involved with post-cardiac care and recovery. So what is CPR? It stands for cardiopulmonary resuscitation. And we are quite literally combining this rescue breathing and chest compressions to support heart and lung when it is not working. There's oxygen already in the blood, and we can also provide a little bit more oxygen if you do rescue breaths with a mask, and this will keep oxygen circulating to the brain until help arrives. So we're going to take a look at a video now on how to recognize an emergency. Let me just pull that up.
Can you believe they're catching the game last night? It was amazing. You know, I thought it was over. I was ready to turn the TV off and go to bed. They got lucky. They had no business winning that game. Look, a win is a win. Yeah, right. Oh, check him out. I think we should break out some scooters on the way to work. I could definitely see you breaking something on one of those. Yeah, right. Hello? I gotta get to the office. Me too. All right. Yeah. We'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Joey, are you okay? Help! Help! Please, someone help my son, please! Joey, are you okay? Oh.
Joey, are you okay? Joey, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have those at the store. Joey!
It's okay, man. He's on the phone with 911. Did you see your son fall?
It all happened so fast, I'm not even sure what happened.
Did anyone else see what happened?
Yeah, I saw the whole thing. He just collapsed out of nowhere.
Was your son complaining about not feeling well earlier today, or?
He said that his stomach hurt. I said we shouldn't go, but he really wanted to ride a scooter. I should have made him stay home.
Does he have any allergies?
No, he has no allergies.
Thank you so much.
So that's a great showcase of someone just recognizing that there's an emergency. They're out walking around on a break from work and not being afraid to step in and say, hey, what's going on? We're going to look at the steps of CPR next, which he did do, so you'll see how that works. with children, it's more likely that they would collapse from a respiratory problem. So that's where we come into this decision of call first or care first. And this is only a concern if you're alone, no cell phone, no way to call for help, nobody's around. But the steps are looking around to see that the scene is safe. In that video, they were out on a street. So luckily they weren't on the road, and it looked like he just fell off his scooter. So we didn't see any danger there. So he was okay approaching the scene. And he did the right thing. He said, "Hey, are you okay?" And you tap really hard on the shoulders. We're trying to get a response. So it's okay. We're actually trying to stimulate them a little bit, maybe cause some pain or wake them up if they're asleep. And he heard the mom calling the child's name. So he used that also, and that's helpful for children. Um, in the video, the child did move around a little bit. Responsiveness means any movement or their eyes open or flutter or mumbling if you hear something. So he decided to call 911 anyway and stay with them. And then he continued on asking some more questions. But if they are responsive, you can just call for help and wait with them and see what's going on. CPR is fun when we are not responsive. So next step would be to check and see if they're breathing, and you just look and take your best guess. If someone's breathing normally, it'll look like they're sleeping. Excuse me. So here's our call first or care first. If you can call for help, this is the time we do it. If someone else is there, we say, "You call 911." Or if you have the cell phone and you can put it on speakerphone and keep that with you, then we just continue on. If you can't call for help, you're by yourself and you have no way of getting another person or a phone, or it's not working or the battery's dead, then we need you to just keep going with CPR for at least 2 minutes and then take a break if you have to run somewhere to get help. So our ratio is 15 chest compressions, 2 rescue breaths, and continue at that rate until one of these things happens. Either you've done the 2 minutes and you need to leave the scene, there's no help coming and you need to go get help, or if an AED arrives and you can stop and turn it on and put the pads on, or help arrives, the ambulance and paramedics or someone like a medical provider, you see signs of life. And this might be vomiting or a seizure. When we're doing CPR, the body is moving a lot because we're forcefully pushing on it. So it's actually kind of hard to tell while you're doing compressions. So that's why every 2 minutes we do stop and check if it's not clear. Or if the scene becomes unsafe, something happens, or if you're too tired to continue. So after about 20 minutes of CPR, if there's been no response and you have no help, it would be okay at that point to definitely take a break or stop if you need to. So for infants, just a small difference. We're still checking the scene and checking then to see if they're responsive, but a very small infant, we're not going to tap on the shoulder. We're going to flick on the bottom of the foot, take their sock off and kind of poke on that. Then see if they're breathing normally. And again, we have that decision point, care first or call first, same ratio for infants. And then you'll see in the next video, the rest is the same, except for when we do chest compressions, since they are so small, we might use 2 or 3 fingers. So let's take a look at CPR for children and infants right now.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches. And for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a past neutral position. For a child, you'll only need to tilt the head to a slightly past neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4.
Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have performed 5 sets of CPR on a child. You are alone and need to call 911. EMS personnel take over. You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2 and the AED and for safety.
All right, I also want to show you part of the infant one. We won't go through all of it.
If an unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR. Ensure the infant is on her back on a firm, flat surface such as the ground. Next, stand or kneel to the side of the infant and place 2 fingers on the breastbone just below the nipple line with your hand closest to the infant's feet. Now, give 30 chest compressions. Using the tips of your fingers, push down about 1.5 inches and then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. After the 30th compression, prepare to give 2 rescue breaths. First, place a breathing barrier over the infant's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a neutral position. Make a complete seal over the infant's nose and mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets.
Pause there, and then let's go back to our list. So you'll notice on the video, it does say 30 and 2. That video from the Red Cross has not been updated. The children and infant, which is like 12 and under, were increased to 15 and 2 back in November of 2020. Adults are 30 and 2, and it did used to be all the same ratio. And again, you don't have to have these numbers memorized. If you're calling 911, they will instruct you with the current method, and also even just doing chest compressions is fine. We're not as concerned about the ratios and such. I just wanted you to see that she did flick the foot for the infant, and also the chest compressions are just a few fingers compared to the 2 hands for adults. So you can see you do put your hands in the center of the chest. The rate is 100 to 120 compressions a minute for all ages. And it's that Staying Alive song from the 70s, if you know that one. The depth just goes by, if you're looking at the side of the person, if they're laying on the ground, we're trying to go a third of the depth of the chest. And again, the numbers don't matter. No one is getting out a ruler. This is to help you remember that we don't want to go halfway down, but we don't want to be shallow either. And every time we have an interruption, it needs to be less than 10 seconds. So that's calling 911, checking for breathing, switching providers, putting AED pads on, doing rescue breaths. Whatever we're doing that is not chest compressions needs to be less than 10 seconds. We saw a couple different ways of opening the airway there for adults and children. Basically every age except infants, you're going to do the head tilt, chin lift, and really try to open that airway, especially for older adults like teenagers, adults, that kind of thing. As we get larger, we need to open the airway more, because when people collapse, they tend to kind of drop their tongue and their chin and everything like that. Excuse me. You saw for infants, it was basically flat. We don't overextend an infant's neck because that actually could be dangerous for their neck. The jaw thrust is used if we suspect a head, neck, or spinal injury. And in that case, you're really just trying to open the jaw, maybe open the mouth, and we're not doing anything to the neck at all. So hopefully you have a mask or a seal, a barrier, and we try to deliver 2 breaths, each lasting 1 second, and limiting the interruptions. Now for choking, adults and children are the same. We are trying to encourage the person to cough. If you hear any coughing or choking or any noise, even if they can't talk, but you hear wheezing or squeaking, they are still getting air. So they are still breathing. So at that point, you can call 911, but we're encouraging them to cough and get in a good forward position to try to get that out. At the point that the person is no longer making noise is when we step in to do abdominal thrusts. And we can do this if they're seated or standing, either one. And you make a fist with one hand and put your other hand flat on it. And then you can't see here, but you're going to put it in your stomach area, reach around that person and put it in their stomach. And then we just pull in really hard, kind of in and up. And we're trying to just push that stuff right back out of their throat so that they throw up. That's the abdominal thrust. For infants, since if they are small enough to hold in your hands, we can flip back and forth and alternate back slaps and chest thrusts. And a chest thrust is the exact same as a chest compression. It's a few fingers right on the bone, not the stomach. So we'll see the positioning here.
If an infant is conscious but choking, deliver 5 chest thrusts using the 2-finger technique, resting the infant against your forearm and thigh. Turn the infant over and deliver 5 back slaps. Continue alternating 5 chest thrusts and 5 back slaps until the airway obstruction has been removed. Make sure to support the infant's head and neck when delivering the chest thrusts and back slaps. If the infant becomes unconscious at any time, begin CPR.
So I mentioned this earlier, injury is unfortunately the leading cause of death for children. That's over age 1. The leading cause of death for infants is respiratory arrest or sudden infant death syndrome, cardiac arrest. So kind of more of an unknown for infants. We've covered these first couple topics: asthma and allergies, concussion, head injuries, and neck and spinal injuries. So this month we are going to be discussing bleeding and burns. So you're probably all familiar with bleeding. That's just any cut from anywhere. Lots of different situations can happen with bleeding, but we're really going to apply the same technique of any clean cloth, or if you have gauze pads, paper towel, napkin, just put pressure on. Once the bleeding stops, we can wash around the area and put a Band-Aid on. I'll usually do the antibiotic ointment at night with a new Band-Aid on my kids and just check it each day to make sure it's not getting infected. So really the only problem is going to come if the bleeding doesn't stop, which is an emergency. So we have capillaries, veins, and then arteries. Capillaries in the fingers, you cut, you can, just have a drop of blood. A vein is going to bleed a bit more. And then an artery is life-threatening. So hopefully you don't see that, but that would be like number 5 here. If it's squirting or pulsing. So if you cut somewhere that has an artery and it's literally shooting out in spurts or is matching what you would guess to be a pulse, that's an artery, and that is not going to stop on its own. Don't even wait the 15 minutes, just call 911 and keep pressure on it. And then the only other trick here is once we put a bandage on, it's very tempting to peek under there and see what's going on to see if it's still bleeding. But even if it's stopped and you lift that up and look, it's going to rip up whatever scabbing and clotting has just happened. So we never recommend looking under that bandage or taking that bandage off. Once the bleeding has stopped, if the bandage comes off on its own, then you can do the Band-Aids and such. But for a serious wound, we're going to keep the bandage on. If you see that the blood is coming through, you don't even lift that one up. You're going to just put more on top of it. And at that point, we use Kerlix, which is the round bandaging gauze that's a little bit thinner. And so we would leave all that gauze on there and then just wrap a roll of gauze around it and tie it pretty tight, because at that point we're trying to stop bleeding. You can also lift the extremity up above the heart if that's possible, or have the person lay down. You may also need a tourniquet if you are in the artery situation, and we'll see that on the Red Cross slideshow part. This is the question I always get asked, and sorry for the gross picture, but that is a picture of a pretty normal head gash on a kid falling, running around the house, and they hit their head or their chin. That's very common on furniture, or even on each other, on their siblings. So if it's open like that, it needs stitches. That is what gaping is. I also go by the 1/2 inch. So if I look at it and it's close together, but it's very long, they're running around and they cut themselves on something that ended up sticking out somewhere, that can do like a long slice, that would need stitches. Also that's the spurting, pulsing, that's artery, that definitely needs several layers of closure. If it's an outside wound and it has lots of dirt and debris, or it might have been the metal or the rusty metal, and you are dealing with tetanus shots and boosters, all that needs to go to the ER. The other recommendation is just, sometimes you look at it and you're like, oh, that looks really bad. Then that needs to go to the doctor and probably get stitches. All right, so let's take a look at the bleeding video.
Most kids get cuts and scrapes once in a while. Knowing how to care for these minor wounds will let them get back to playing quickly. But keep in mind, blood can be frightening to kids. While providing care, talk to the child and make her feel more comfortable.
Here we go.
Begin by covering the wound with a sterile
Real hard
gauze
to
pad
stop that bleeding,
and applying
okay?
direct pressure until the bleeding
You're being
stops.
such a brave little girl. Looks like the blood is still coming through. I'm going to get another dressing for you. I want you to replace my hand on the count of 3, okay? You ready? 1, 2, 3. Okay. Good girl. So I'm going to put this back on. 1, 2, 3. There we go.
If blood soaks through the first gauze pad, put another one on top and press harder to apply more direct pressure.
Good job.
It may take several minutes for bleeding to stop. Do not remove any gauze pads. If the bleeding does not stop, call 911 if you have not already done so.
So I want you to
Continue to care for the person and monitor for shock.
1, 2.
Once bleeding is controlled, check for circulation beyond the injury. Note the temperature and color of the skin and ask the person if there is any tingling or numbness.
Any tingling or numbness, honey? No. You sure? Yeah. Okay, we're almost done. Okay, you hold on to that and I'll be right back. So we're going to put a bandage on. So I want you to move your arm. Your hand up
Place
to
the
lip.
end of the bandage on the dressing at a 45-degree angle.
Put your finger right there for me. Thank you. You can place your finger now.
Continue wrapping the bandage over the dressing.
Almost done. We're almost done.
Once the dressing is covered, roll out the remaining length of bandage. While holding the bandage, use the index finger of the other hand to split the bandage in half, moving it down and underneath the limb.
We're
Bring up the
almost
two
done.
ends of the bandage and tie them in a
Almost
bow
done.
or a knot.
Hang in there. Hang in there.
Check
So
again
we're
for
gonna check
circulation beyond the
okay?
injury. If there is any change, the bandage may be too tight, and you will need to carefully loosen the bandage.
Any tingling or numbness?
After the bandage is appropriately applied, remove your gloves and wash your hands.
So that was some fancy tying at the end. When I teach CPR and first aid in person, we practice all that bandaging because it can definitely be hard to do if you've never done it. But basically that means roll out that Curlex that I was talking about, which will really cover any, arm or leg, like on a limb. That works really well. And then just leave some at the end and try to tie it. Doesn't really matter how you do it. There's a couple ways, and also you can use tape if you have it and tape the end. But otherwise you just don't want that hanging off like that. So let's take a look. I think they have, there we go. This is an example of a tourniquet you can purchase, and they don't show you on here, but definitely you can use any, belt. It's better than a string that is small or like elastic can cut further when it's really tight. So it's better to have something that's flat. And that stick that you see on the end, that's what is important to, it helps twist it at the end. So if you're interested in more education about that, I would suggest just looking that up, because we don't need tourniquets too often, fortunately. But if you are waiting for the ambulance or you're in a mass casualty situation, we don't want to be, but of course that is what we're going to need to do. Gunshot wound, things like that are really, really bleeding. You want to put direct pressure on and then find something to tie above the wound. Think of, we're blocking between the heart and the wound. We're trying to block the blood from continuing to come out. So we only do that if we're in a life-threatening situation. And we just put a tourniquet on. We're trained to, label it, put the time on it, so that when the person does get to the ER, they know how long it's been on. We're not gonna watch that one. Hemostat is another type of thing. You can actually purchase this now at like Walgreens or CVS, and it comes in little packets. It's like black sand, and Sometimes they're even in dressings, like in a Band-Aid, you can buy it. And again, this isn't something we're gonna need very often. It might be in a summer camp first aid kit, or if you're going on a hiking or adventure group or something like that, where you just are gonna have more situations of being out and not being able to get help quickly. But it's a nice chemical that we have now that you just pour into a really deep wound, and it clots the blood for you. So it's using a chemical. And nosebleeds. Um, we used to always see people kind of leaning back, but we found that that just runs blood down the back of your throat and makes people vomit. So you can see her leaning forward. That's the best way to do it, is just lean forward and pinch on there. And I'll also put ice up on the forehead or even on the back of the neck, that kind of thing, and pinch and wait for it to stop. If it is more than 15 minutes, same situation, you need to go to the hospital. And I have also seen in sports where getting hit in the nose caused the shooting of the blood. So an artery was severed from a broken nose bone. So that was pretty severe, and we didn't wait at all on that, and they had to go right to the ER and get surgery for that. So we're gonna take a look at burns next, and then we'll wrap up.
Burns can be caused by contact with extreme heat, chemicals, radiation, or electricity. Burned areas can appear red, brown, black, or white. You may see swelling, blisters, or both. To care for any type of burn, remember 3 simple steps: stop, cool, cover. After sizing up the scene, stop the burning by eliminating the cause of the burn if it is safe to do so. Next, cool the burn using cool or cold clean running water for at least 10 minutes. Finally, cover the burn loosely with a dry, sterile dressing. Burns involving blistering or broken skin should be evaluated by a healthcare provider. Some burns are minor and require only first aid care, but others are critical and require a call to 911 or the designated emergency number. To decide whether a burn is critical, look at the following factors. What caused the burn? Burns caused by electricity, chemicals, nuclear radiation, or an explosion are considered critical burns. How deep is the burn? Burns can affect only the top layer of the skin, or they can extend through the deeper layers of the skin or the fat, muscle, or bone underneath. The deeper the burn, the greater the severity. How much of the person's body is burned? A burn that covers more than one part of the body or covers a large percentage of the person's total body area is considered a critical burn. Where is the burn located? Burns in areas where they could impair function or the person's ability to breathe, such as the head, neck, hands, feet, or groin, are considered critical burns. How old is the person? If the person is younger than 5 years or older than 60 years, consider the burn critical unless it is very minor. If you think that a person has a critical burn, call 911 or the designated emergency number immediately.
So they mentioned different types of burns. Thermal is our sunburn or a stove. So it's just heat, what we would think of normally as a burn. And you need to remove the source of the heat. So stop touching the pan or get out of the sun or whatever the situation is. Chemical burn can be cleaning chemicals or in a science lab, or just pool chemicals, things like that. If it is liquid, we want to take off that part of the clothing that has been contaminated, because the clothing then will have the liquid and can continue to burn the skin. If it's a dry powder, you don't want to just brush it off with your own hand. You need to use something else or put gloves on, get that off in the clothing. And electrical, of course, we need to remove the person, but we have to watch that situation, because if they are still in contact with the electricity, then you can also get a burn or electrocution. So you have to get that turned off. So that's a more complicated situation. We're going to cool it with just cool water or cold. We don't use ice because that can cause frostbite, because we're not going to feel in that area the same way. Our sensation will be off. And then cover it with sterile dressing. So heading back to the list. Just to give you a little more education about this, we used to call them first degree, second degree, third degree, and now they are called superficial, partial thickness, and full thickness. So first degree is our sunburn. That's the one you see on the chart. It's red and there's no breakage of skin or blisters. Second degree is partial thickness, so that means it's coming into the dermis. It's gone through the epidermis, and now we're in the next layers of skin. That's where you get the blistering and swollen and very painful. So a sunburn that blisters is technically a second degree burn. Third degree is an emergency. You need to go to the ER, call an ambulance, or go to a burn center. And that's full thickness. That means it has gone through the epidermis and the dermis, and now we could be into burning muscle or veins or bones. It's not a good situation. That will look like a piece of wood that has burnt. It will look like charred, or, you know, after a campfire is put out, that's what it's going to look like. It does not look good. There's no sensation, and people often do not feel pain at this point if it's burned that badly. So that does need medical attention right away. So there's examples on the pictures. You can see things to do. We want to cool it right away. 15-20 minutes. You can use cooling ointments that feel good to you, lotions, things like that. Bandage with dry gauze, and then you can take Tylenol or ibuprofen. You should not be putting other things on burns, you know, butter, oil, things like that that we learned growing up, and not ice, because that can also cause frostbite. So here's our overview again of everything that we went over. And I am going to show you our website next, so that you can take CPR for free if you're interested, or where you can look up anything else you want on first aid. So your code that you're going to use is Helpr CPR. And we're going to go to the website now, which is Save a Life. You can Google savealife.com. And I'm going to put this into the chat box so that you can see it. It's NHCPS, which is National Healthcare Provider Solutions, which is another sponsor for our savealife.com. But you pick CPR and put that in your cart. I don't know what that is. Oh, we have ACLS in there by accident. Okay, let me put CPR in there. So the code works on the regular course, not on the ones that say for life. Hey, I'm sorry, this is not correct. Here we go. Edit shopping cart. Let's take that off and put CPR in. I know you guys can figure this out, but I like to show everybody how to do it. Well, anyway, you put the code in. We will just, I don't know why this isn't working. Let's do it again. No, okay. I give up. You know how to do it. The code is Helpr CPR altogether. So HELPR CPR, and that will give you CPR for free. So instead of $59, when you put that into, there's a spot that says coupon code, and then it'll get you for free. So here we have enroll, do the course. There's an exam at the end. You can take it as many times as you want. You can log out, you can look things up. We want you to just learn the material. And then once you get over 80%, you pass and you will be CPR certified. We will get a card instantly that you can download and print out, and you'll have a regular CPR card, and that's good for 2 years. So this is a great deal here. And the courses are here. There's practice tests. We do also other courses for healthcare providers. So I have BLS, ACLS, and PALS for healthcare providers. But we have the mega codes, algorithms. The mobile app is great, called MediCode. It's on the App Store, and that's free. And it has all the courses, but you can look things up, and you can also practice the algorithms on there. And then lastly is our ebooks that you can download if you want to copy anywhere for work or home, or keep it on your computer. That's a 50-page book. Like if you look at CPR, it has all the first aid in there so that you can look that up. Let's try just one more time to see if I can get this. Okay. So these are all the units for the CPR course. It goes over more first aid, injuries, and then the CPR AED and choking. So I'm going to end there, and please email if you have any questions. And you can also look up the other webinars that we've done for Helpr on your parent resource group website, and your host will tell you about that. And I'm sorry I couldn't be there in person this month, and I will see you then again in June. Thank you.